Your quality of life is getting a little better. Smarter Heart University and Dr. Scott on AM 970, The Apple.
Okay, we're back. Welcome back to your Smarter Heart University. Good morning. So, at our last break, I alluded to two new systems that contribute to developing metabolic syndrome. These are newly discovered, and you heard it first here on Smarter Heart University. Hopefully, you're going to hear a lot of things first on our show over every week that you tune in, and we look forward to bringing you news as it happens. I'm a news anchor now. The first concept I want you to understand is what we call the adipostat. This is the part of your brain called the hypothalamus. And it's really important area of your brain that they've found. Like a thermostat regulates the room temperature, this regulates your body mass. The hypothalamus stimulates your appetite if you're hungry and shuts it down if you're not. So it regulates your food intake. It is very normal in normal weight people. It turns itself off and makes you not hungry anymore. Overweight people lose this ability to shut off their adipostat. It's actually a faulty, thermostat. It's very interesting. And as we'll talk about at the very end, the big question is it all about being overweight? I said the size of the gut was the center of the universe. True, but not true. And that's why they're wanting to change the whole terminology of fat versus thin and sick versus dysfunctional. So I'm giving you, again, a little tease to stay tuned to the end. But so the question is, can a thin person have an abnormal adipostat? I would say absolutely. Okay, I don't think it's all about just the size of your gut. I think there's a lot out there. Physicians, if they're listening in, or if you were to talk to your physician, I'm sure they would probably agree as well. The other system, and again, it got a lot of press a couple of years ago because we thought we were going to have the holy grail of medications that would work on this, is kind of the pleasure center for your brain when it comes to addiction, if you will. It's called the endocannabinoid system. The ECS, I'm just going to abbreviate it. The ECS is turned on by excess weight. It serves as a messenger between your brain and the rest of your body to regulate your hunger. Well, what is this? What's the ECS, the endocannabinoid system? It's a chemical similar to the active ingredient in marijuana. So if you're overweight and your ECS goes into overdrive, you get the munchies. There's no other better way to put it, folks, but that's what happens. And this system got a lot of press because they were able to find a drug. It's still available in Europe, has a lot of side effects, but they were able to find a drug that was supposed to be the holy grail of weight loss. It had a great trial that came out several years ago. I was at the American College of Cardiology convention when they released this as a late-breaking clinical trial, and the applause and the standing ovation for this ability to reverse diabetes and reverse high blood pressure and reverse cholesterol and reverse heart disease and improve your mortality seemed like this was going to be the answer to even surgeries. And we're going to talk about surgeries for people who can't lose weight. So it failed. It failed fairly miserably. We weren't really able to get a lot of weight loss, and there was seizures and some deaths, and they reopened it, and a recent article just came out and tried to re-examine this, and the company went back and tried to fix some things, and it just looks like at this point it's not going to go anywhere. So I'm sorry about that. But why is there no such thing as borderline diabetes? Well, again, about the 10 years before, and again about you're the diabetic 10 years before you're the diabetic. We refer to this as the ticking clock hypothesis. So when we find metabolic syndrome factors, your risk of diabetes increases 5 times. That's what we said. So people, if we find these factors, and remember, you only need 3 of them, as what we discussed in the last segment, within 5 to 10 years, you have a chance of getting vascular disease. And it's such a strong warning signal. And that's what every paper, even the arguments against this, and we'll talk about this on the next segment. It's such a strong warning signal, like the robot from Lost in Space, danger, danger. I mean, it really is a warning signal, and yet a lot of people don't believe in it.
Well, they don't get it that when you're a pre-diabetic, that just means if you get that diagnosis, I'm a pre-diabetic because, I'll have to worry about it down the line. I don't have to worry about it right now because I'm not a diabetic. I'm pre-hypertensive. I don't have to worry about my blood pressure right now because I don't quite have that disease. Well, yeah, you do.
Yeah, you do.
Yeah, you do. Your vascular, the damage is already being done.
Right.
It's not causing severe blockages yet, but it will.
Well,
and
that's
this
good.
is a process that takes time.
That's good, but let me interrupt you. Sorry to interrupt, but so how can we prove it to you? Fine. How do we see this in your cholesterol before your blood sugar gets high? Okay, so this is what I tell our patients when we see this. You have what's called a PBP, a plaque building profile. I start saying this to our patients. Put this in your notebooks, class. PBPs, the advanced tests, these NMR tests it's available at LabCorp, and the VAP tests available at Quest Lab, looking at your bad cholesterol as dirt. Yes, dirt. Normal bad cholesterol and high good cholesterol and low triglycerides, you get nice fluffy grains of sand. Smaller, dense, compacted, and highly concentrated bad cholesterol, lower good cholesterol, high triglycerides appears in the metabolic syndrome patient as well as the typical diabetic patient. That's why diabetic patients, if you're out there listening, you usually don't have high cholesterol. In fact, that was a big step in about 6 years ago when they talked about the trials with statins showing that the diabetic can have a very deadly MUD cholesterol and have it lower than normal and even lower than the typical guidelines would suggest that you wouldn't need a pill, you wouldn't need a statin. And this turned the world upside down at this point. This was a big step. The diabetic patient doesn't have high cholesterol. They have cholesterol that's compacted, small, and MUD. Well, guess what? The metabolic syndrome patient has it first, 10 years before. So this is why there's no such thing as a borderline diabetic. If we see this PBP, plaque building profile, it's a clue, people. It's a clue that you should get to your doctor, and you should discuss with your doctor where you need to go from here to try to reverse each factor. Remember I said, get down to the salad. Reverse. You know what to do. Everybody knows what to do. It's get rid of the sandwich and get down to the salad. And really, that's what it is. It's changing the diet. Ironically, most Americans, though, and I had this the first time I tested myself, have a combination of both, sand and mud. Right in the middle, smack dab in the middle, using this analogy. So we see this MUD or plaque building profile way, way, way before your sugar gets elevated. And that's exactly what you were talking about. And I don't want to interrupt, but your train of thought.
I agree. We and that gets also to the heart of the issue with childhood obesity. Why is it so important?
Yes,
it's because these children are developing the risk and the factors and the biologic processes now when they're young that are leading to the vascular disease earlier and earlier in life. The diabetic who comes to us and they say, I've had only had diabetes for a year, and they got disease all over the place. We know this is not an overnight process. This takes years to occur, and that's why we need to address it earlier on. That's why you need to visit with your doctor early on and address your risk factors and see, do I have these factors that are a risk for the development of disease, development of diabetes, development of high blood pressure in the future? Because shortly thereafter is the thing that's going to kill you and the thing that's going to lead to the heart failure, and that's the vascular disease, the blockages.
Yeah, I mean, so that's why we're kind of feverishly trying to get this point home, folks, and get it on record so that people can listen to this over and over again and tell their friends to listen to it, because this is a message of hope. It's a message of prediction. It's a message that at the level of the child needs to significantly get told over and over and over again. So we're going to talk about what happened to Dan and what you can do on the next segment on your Smarter Heart University. This is AM 970, The Apple.